Welcome to Vet NeuroJar, your source for the latest and greatest in veterinary neurology. Today, we're diving into a fascinating case report on a rather unusual complication following ventriculoperitoneal shunt, or VPS, surgery in a dog. Our story begins with a 4-year-old neutered Border Collie who presented with a 3-month history of some pretty concerning neurological signs, including proprioceptive ataxia, low head carriage, delayed postural reactions in the thoracic limbs, and neck pain. After some digging, the patient was diagnosed with congenital obstructive hydrocephalus with secondary syringohydromyelia. To address this, the dog underwent a ventriculoperitoneal shunt surgery, which was initially successful. Fast forward a year, and the dog is back with the same neurological signs, this time appearing 2 weeks after suffering head trauma. On physical examination, the shunt valve felt firmly filled and non-compressible, raising suspicion of a distal occlusion. To investigate further, radiographs were taken of the neck, thorax, and abdomen to check the integrity of the shunt catheters and valve. The dorsoventral images revealed a rupture of the distal catheter near the valve, a detail that was easily missed on the lateral views. Computed tomography confirmed these radiographic findings. The dog then underwent revision surgery, where the affected part of the shunt catheter and the valve were replaced. Thankfully, the patient recovered well, and a month post-surgery, a neurological exam showed only mild proprioceptive ataxia, with the other signs resolved. Now, ventriculoperitoneal shunt complications aren't unheard of. Previous veterinary literature describes issues such as ventricular catheter migration, infection, kinking of the catheter, disconnections, and even skin necrosis. However, what makes this case unique is that it's the first reported instance of a ventriculoperitoneal shunt rupture following head trauma. The authors of the study emphasize a few key points. First, this case highlights the importance of considering shunt rupture in patients with a history of head trauma who show a relapse of neurological signs after shunt placement. Second, it underscores the need to perform orthogonal radiographic views of the shunting route to catch these ruptures. Finally, the authors remind us of the potential utility of manual valve evaluation to test shunt sufficiency. That's all for today's episode from Vet NeuroJar. Keep those minds inspired, hearts light, and tails wagging.